Tuberculosis has infected 1 out of 3 people worldwide and continues to affect your community. Thank you to the courageous men and women who are sharing their stories in the hopes of spreading knowledge and understanding.
I think that the biggest issue that I have determined over the years of working in First Nations is that it's the housing issues. There's so much overcrowding that any communicable disease is going to be more prevalent, and especially things like TB that are spread through airborne transmission. In the past, there was many Aboriginal people that were sent south to sanatoriums. They didn't really understand why they were there. They didn't take their meds properly. So now we're dealing with a whole group of people that weren't treated properly, and as they get older, they're reactivating, and I think that's part of the issue too. Often people experience a cough that just won't go away, like you get a common cold, but then your cough lasts for 6 weeks or 2 months. You experience night sweats, so people will often say, I wake up in the night and my clothes are saturated. I'm really sweating at night. There's sometimes if they cough up anything, it's streaked with blood, so they have those symptoms. And weight loss in the end stages as the disease gets more progressive. You can come to the clinic and we'll check your chart and see if you've ever had a TST. If you've had a positive MAN2 in the past, then we would go to collecting sputums, and it's 3 sputums on consecutive days to try to get the bacilla if it's in your body, and then a chest x-ray is the other thing. You're treated twice a week for 9 months, and then you're considered to be germ-free, and if you're an active case, then you're on daily medications, and then after that you're on this 3 medication regime twice a week for 9 months too. So, and it's unless you run into a strain that's resistant to the drugs that we're providing, it's 100% curable. Treatment has come a long way. You don't have to be frightened of having tuberculosis. You're not asked to leave your home or your community. You're well treated right here. But come to the clinic if you're at all concerned, and we'll deal with it.
It's too crowded in the house. There's about 9-10 people in the house. Even my house, I got 16. It's a small house now. It's not a big mansion house or anything. It's just a small house, and there's in one room, there'll be about 4 or 5 people in there. And when they cough, it stays there. And when you walk through it, you catch it.
Night sweats, cough more than a month, tiredness, loss of appetite. That's the sign. They come to the clinic and get tested for TB. And if they have a skin test positive, they get a chest x-ray and sputum. And if they have TB, they start meds right away.
We let them see the doctor, and the doctor, if there's 2 different TBs. There's pro and active. So if they're active, they start 28 days, they're on meds, and after 28 days, they go, that 28 days every day, and after that, twice a week. Now it's new again for us. Monday to Friday, and then 3 times a week now, till 9 months. We can stop TB from spreading. Some people just, when they're spreading, they spread it for about 3 or 4 months before we find out. That's why now we do a contact trace. We know if you have TB and we took your spits and you're spreading it, that's the only way you find out when you're spreading it or not.
When a person has a TB, we test them, we test the whole family so they don't get sick. If there's a positive skin test, they treat it so they don't catch a TB.
We gotta look at them to take them. Yeah. If it's a little kids, we usually check their mouth. Because then sometimes they just keep it in their mouth, and when we turn around, they'll just throw them away. Yeah, yeah, and we have to watch for side effects and all that. So they won't, like, if they're allergic to it or something like that, then we let them go back to the nurse and check them out, and if it's because of these pills, they stop. And there's lots of ways to do it.
How I found out about getting a TB was, there's that other lady here who was working before for TB. I came up to her and visited her. And I asked her questions, how I was related to TB. A person makes you lazy, makes you feel lazy and tired and sweat a lot sometimes, it says. And I told her, maybe that's my problem, because I lazing around a lot. I don't hardly do nothing, no mood, no happy feelings at all sometimes. So she drove me over to the nurses there, and we have a needle, and then it came out positive. And that's when I noticed I had TB.
I was lazy, cough more than 4 weeks, tiredness, fever for a month. Even I wasn't eating appetite, losing weight every month, get sweat every day. Before checking my TB, and I got checked up, and I have TB, and I'm so sad about it. And even my friends and all the community doesn't want to hang out with me anymore.
I want to get better soon, and so I didn't feel happy about it in first, but I had to do something in order for me to get well, to get better again, so I got treated. It is important to know about TB stuff, you know, because it can affect you for your health on the side in time if you don't take care of it. And if you have families or other people that you care for, it's better to let them know that you have that problem, because you don't want to spread it around. I know they're working hard, and they've been doing this for quite a while. And I think they're doing a good job with what I see. Glenda, for instance, she's been delivering meds to other TB clients out there. Even if it's almost 40, 50 sometimes, we still walk even towards the end of the house. And that's how many blocks from here. She's been doing that for quite a while, and June's helping her as much as she can too.
She always gives me her pills, and she always talks to me about TB. So I end up follow his directions. So I almost finished with my TB pills.
I understand that there's a lot of problems related to TB if you don't take care of it, I heard. It's better off for everyone to know and to find out as soon as you feel tired, lazy, or not up to doing anything at all, just sleeping around. If that's how you start reacting, then get yourself checked up immediately, and then you'll get back to your feet again.
I was saying I'm having TB, so it's not contagious. I already have care with TB pills, and they said okay, and they tried to hang out with me again.
For more information, talk to your local nurse or TB worker, or check out www.tbfacts.org.